Y'all, it's hot out here. It's a Texas morning. It's 8 a.m. and it's probably, oh, I don't know, 80 degrees, but very humid. See, he doesn't think so, but I think so. This is Fern, aka Red. I call him. I don't know why. He just looks red to me. Okay, that is not food. Red is an 8-year-old off-the-track thoroughbred who came to us, donated to our facility from some very nice people who rescued him from a kill pen. I don't know much about his history. I haven't had a chance to research his tattoo, but Red is fitting nicely into the herd. He is at the bottom of the herd. He has been stalled for most of his life, but he loves being outside. All my horses roam freely. He is very sweet, very, very sweet, but he's a little skittish. He's a little nervous, and so that's why I thought CranialSacral Therapy might do some good for him to relax him a little bit. He, as you can see, is very curious and likes to rub his head on you. But as I said, he's 8 years old. He recently was lame. He had a really bad case of thrush, which we fixed. Had been treating for. So we're going to do just a little bit of movement from him so I can look at him a little. But I just wanted to keep that in mind. And then we'll get started with the rest. So first I want to do is I want to take some vitals for him. And we're going to just look at see how he is right here with the dehydration. Oh, no, bounces back really good. So he's very good there. He's like, what are you doing, lady? And I want to see his gums. Oh, nice and pink. You got still a lot of alfalfa in your mouth, but they're nice and pink. Okay, I'm going to go to the back here and take his temperature, which I'm sure he will love tremendously. And then I'll come up and do the breathing. He apparently does not like his tail to be messed with. Easy, 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 easy. Okay, it says 98. So we're good there. But we're going to work on that, aren't we, sweetheart? And last but not least, I'm going to do the breathing. Set a timer for 1 minute 30. Or respiratory, I said breathing. And this is actually the heart rate. I'm messing up all kinds of mornings. Okay, buddy. Okay. It's at 39. All right, there, buddy? All right, let's do another breathing or respiratory. That was his heart rate. Now I'm doing respiratory. I'm messing up all over the place. I'm so sorry. I do know what I'm doing. Sometimes. Set a timer for 1 minute. Oh, yeah, no. Set a timer for 1 minute. Okay. Whoa, that was 30. That was good. He's a little riled up because you can hear somebody yelling in the background. One of the dogs is trying to come out here. All right, so he's doing good. You might see some other of his friends in the background. They're always very curious when we're in here. So I'm gonna hit pause on the video right now, and we're gonna do some gait movement and see what we're up against. So I should tell you that he hasn't been with us very long, perhaps, oh, I don't know, a couple months. And so he's still learning, like he still wants to eat. I don't know what kind of training he has. Being a thoroughbred, I'm not quite sure. So we're gonna get him and do this the best we can. If he trots, that's fine. His lameness is healed really good. They did tell us that he wasn't balanced very much.
Good boy.
But, you know.
Come on.
We haven't been able to work with him, as I said, because of his lameness. But he seems to be really driving well.
Easy.
Okay, good. All right, we're going to turn him the other way. See if we can go. Again, sorry for not having him like perfected and lunging yet, but I really wanted to do the CranialSacral on him because I really thought it would help him. So this is him in a walk.
Good boy.
He's got a good stride. And if you had seen him when he was lame, my God, it broke my heart. He's driving so much better now. Okay. That's all I'm gonna to show you. We don't have our pick out here, but you can't really see. But there was a big old crack there, and now there's not. It's really done well. So we're very pleased. That's good. So yeah. I'm gonna tune into him right now and just, you know, see how he's feeling, how his, you know, energy is moving throughout his body. And I'm just gonna do that by placing my hand. Good. Those are the flies bothering him, but you can notice the softening of his eye when I was tuning into him. Again, I think he's a really good horse to do this in. So we're going to do the pull hold next. Okay. I mean, he's going to sleep. he might be better at this than I led you all to believe. Okay, so I'm gonna go down the vertebrae, starting at C2 and go down. And we're just gonna place our hands. Here, that was really rude, me placing that in front of your nose, wasn't it? You know, the CranialSacral isn't intuitive. I'm just sending good thoughts, good energy to him. Sending relaxation. His head's getting heavy on my arm. He's lowering his head. This is all designed to give him some relief. All right. I'm going to do the shoulder hold next, and I'm going to do it on both sides. First thing I'm going to do is place my hand on the superior and the inferior scapula. twitching again is just from the flies. I can see one landing even when I was working on it. Again, same side, or different side, same procedure. Man, let's get back into the focus. Good boy, good boy, good boy. And I noticed on that side, I saw him twitching again, so maybe it's not the flies. He's never had massaging before, so I don't know that he knows exactly what to expect or what I'm doing, but we'll keep going with this. We're going to do the thoracics next, where I'm going to place my hand on the withers and put my hand on his chest for the first part, and then I'll move it to behind his arm here. Are we going to graze a little bit, buddy? But thank you for standing here. Whoa, whoa. He's decided I no longer want to stand here. That was a good sigh. Okay, good boy. And then I'm going to keep my hand on the withers, and I'm going to place it right here behind his arm. He's definitely shaking on that side. All right, let's move up. Maybe the flies are bad in here. Come on. Come on. All right, he doesn't want to move up. That's fine. I'm going to do the lumbar and the sacrum release. There's some bestial flies. And so what we're going to do here, get this around your neck again. Sorry, buddy. Is we're going to, where are you going? You want to walk up here? Come here. There we go. Whoa, good boy. You're such a sweet boy. We're going to do the lumbar release. Hold on, I'm going to check. I'm sorry. Just to be sure. Okay, that's what I thought. Okay. His umbilicus, or what, for horses might be considered a belly button. Good, because the gut sounds. Feels like he's holding in. There we go. I was waiting for that release because he felt like he was holding his breath, this is uncomfortable for some horses, especially this one. I'm going to put it on top of the sacrum here and put it right in front of his sheath, which is a tender spot for some horses. If you could help me, Reagan, see if you see any kind of softening, any kind of release. It's hard to see way back here. He's a big boy. That was a good breath.
His lip loosened.
Good. Yeah, he's a little bit tight, and that could be just from being uncomfortable. That could be like, what are you touching? So the next thing I'm gonna do his tail, and then we'll do some leg unwinding. And basically what we're doing here is he when I was putting in the thermometer, I noticed he wasn't a real big fan of me picking up his tail. So we'll see what happens. I'm just gonna, oh, he's much better at it now. Maybe it was just because of the thermometer. He's not giving any resistance. Good boy. Okay. Good boy. Okay. And now what we're going to do is just some leg unwinding. And basically, I'm just going to be picking up his legs and seeing, you know, if he tells me which way to pull it, or if he tells me just to put it down, or if which way he wants to move it. It's just a basic. Now, he is a little stubborn sometimes at picking up the hooves, so we'll see what we can do. I'm going to turn around this way, as if he were getting a farrier treatment, or cleaning his hooves out, rather. Come on. Come on. Come on. I don't have my pick with me. There we go. Good boy. And we're going to set it down just gently. All right, we're going to move to the back here. We're going to do the same thing. It's okay, Papa. Okay, he's telling me he's pulling it out a little bit. So this one might need some work. It's okay, Papa. Go around and do the other side. You're doing so good. I'm so proud of you. Licking your lips, that's a great sign. Are you enjoying this, Bubba? Okay, come on, can I pick this one up? I need to get these butterfly eggs off of you. Come on, come here. There we go. Licking your lips. Oh, you're saying put it down? Okay, all right. I listen to you. And this is the one that was kind of lame. Whoa. So I'm going to let that one go. We picked it up earlier. I don't want to stress him out too much. So based on what I'm seeing here, come here, baby. Come here. We have a lot of work to do on working. So what I'm going to do here is I'm going to just go deeper on a couple things. And if you know, we'll pause every once in a while to give him some some time to reflect. I'm gonna break every once in a while just to process what's happening. And when you see him licking those lips or his eyes drooping, he's processing. You're doing so good. I'm so proud of you, buddy. But aside from his legs and stuff, which I'll, you know, work on in my massage, I think what I want to do is do a TMJ, because a lot of times horses can hold tension there, and do give them an ear release, because that's another place up here is where they can hold some tension. So you can either do it one at a time, the TMJ, or you can do it together. I'm going to try to do it together. If it doesn't work, I'll do one at a time. But I'm going to place both of my hands on the TMJ joint. And again, he's never had this before. He's not enjoying it. Just tried to help you, buddy. Looking for release. I'm gonna call that a win. He stopped jerking so much. Again, he's not used to it, but I could also feel, I don't know how to explain it, but just some weird energy right there. It wasn't flowing. It didn't feel good to me. So I'm gonna now try the ear, where you're just gonna grasp the ears gently at the pole, or at the base rather. We're just gonna hold. So now we're going to do some cranial bone adjustments, and we had to take a break. He had to eat. My horses are very food driven, and you can see from his nose he's quite the enthusiastic eater. So because of his emotional issues, nervousness that is, and some balance issues allegedly, I'm going to do the parietal, I know I'm saying that wrong, frontal and lacrimal bone adjustments. I want to see if those help. First I'm going to look at his teeth. I want to see, I mean, they do look slightly askew to my right, your left. So I've taken some pictures and we'll talk about that in the case study. But in the meantime, you know, I don't feel any, like, now that I've messed with his mouth, I don't feel any like raisedness or adjustments on his bone structure here. He's got flies bothering him. So I'm just gonna try to do the parietal, and I'm gonna just picture the bones coming towards my hand. Ooh, that felt good. Right. And we're going to put our fingers here on the frontal, where the sutures are. Okay. Flies are bothering him. I'm going to try that again. I know, baby. All right. And the lacrimal. Okay. You're a good boy. He does have some tear discharge too, or eye discharge, so hopefully this will help. I have a picture inside that I took, and I mean, he has a very symmetrical face, I think. Slight adjustments, as I noticed and mentioned, from the teeth, so we'll do this a few more times as we do the cranial therapy with him. I think it's going to do a lot of good for him, his condition, his, quote, balance issues, if you will. And then we'll start with some massage therapy, too. As I said, he's been new with us, so we haven't been able to do much with him. So thank you.